Are you one of the millions of people around the world suffering from neuropathy? Is your nerve pain keeping you up at night? Is your nerve pain limiting you from living a normal life? If you've said yes to any of these questions, you deserve to keep watching this video, because I'm going to share with you about this man's complete recovery, complete elimination of nerve pain, and the causes of his nerve pain that evaded the doctors, the hospitals, who tried to give him relief, who tried to find the answers. They used a spinal tap, MRI, nerve conduction study, blood tests. They couldn't find anything causing his nerve pain. In 2 treatments with me, Dr. Lonnie Herman, his pain is gone. Let's listen to some highlights from his video testimonial. And once you're done with the highlights, you're going to come back here. I'm going to describe what I found in his exam that we treated. And then at the very end of this video, you'll be able to watch his whole complete video testimonial. Let's watch the highlights of his video testimonial right now, and I'll be back in just a moment.
I was suffering nerve tingling from the top of my head to the bottom of my feet. My hands were tingling, my arms were tingling. The back of my neck and shoulders had a burning sensation. Also muscle fatigue, especially in the leg area. So I went through a protocol regimen with Dr. Herman, and I saw a significant improvement towards the end of the first let's call it the first session. Protocol.
When you say significant relief, that was about how much, percentage-wise? If you could say like a 50% reduction, a
No, I would
20%,
say
80%?
by December, I noticed probably like almost like say, for instance, like a 70%
70% reduction.
relief, exactly. And then we continued with the second protocol. Right now we're on March 3rd. I'm approximately 2 weeks away from finishing the final protocol, and I would say I'm probably on 90-95%. Every so often I may have a little bit of tingling on my hands, but compared to what I was back in September, I would say it's night and day. Back in July, I didn't work out since mid-June, to be quite frank with you, and then I started working out now since the beginning or the middle part of January, where it's my own confidence level I was concerned to start, because I was afraid that some of the exercising would initiate some of the neuropathy feeling. So once I overcame that fear and started working out back in mid-January, I noticed that I had no ill effects, and I'm pretty much back to the way I was prior.
So your friend had referred you here, somebody who I know, who you know, and you gave this a shot, and right now, in the end, you're already referring a loved one here.
Oh, yeah.
Because you see a big difference in your body.
Absolutely.
And while I wanted it to be faster, just like you did, because the sooner you're better, the happier we're all going to be, and we can help other people like you who are watching this realize that you can overcome neuropathy and muscle fatigue when we do the right work.
So when someone referred me to Dr. Lonnie Herman, to be quite frankly, I said, why not? I mean, I'm open-minded. I saw the videos. I did my own personal research, and none of the remedies are anything that's that could harm you. So I said, let's do this. I'm glad I took the leap of faith, and I'm grateful. And I certainly wouldn't be referring anyone if I truly wasn't grateful and a believer.
So in just a few minutes, we're going to flip to another video. I'll be back soon, and you'll hear about his unique exam findings that he's given me permission to share with you, and I look forward to helping you get better too.
Isn't that incredible? He has complete relief from the nerve pain, from the burning sensation, from the weakness in his limbs. I'll tell you, he can exercise again, because the exercise was causing the symptoms to really become really bad. So I'll tell you right now, I found with him that his glial cells, which are the cells that protect the nervous system, repair the nervous system, and reproduce the myelin in the nervous system, His glial cells were infected with the influenza virus. His spinal fluid, which is the fluid in the brain, in the spinal cord, around the brain and around the spinal cord, the spinal fluid had the influenza virus and the St. Louis encephalitis virus. His brain was infected with the Epstein-Barr virus and the St. Louis encephalitis virus. The meninges, the tissues around the brain and spinal cord, infected with the St. Louis encephalitis virus and the influenza virus. Let me pause for a moment. You might be asking already, how could I, Dr. Lonnie Herman, how could I find these things causing him his problem? I'm going to get there in just a moment. Go back and watch what he just said. He has complete relief. The hospitals couldn't help him. The doctors he went to before coming here couldn't help him. So it is not too good to be true. And when we can think outside the box and get the answers for people of what's causing their condition and work on removing the causes of the disease, relief can happen. And he just said it to you. If you go to my website, drlonnieherman.com, look around. We've got some incredible testimonials of people who've recovered completely from their different diseases with my work. You can download my free ebook, read through my free ebook. It's only 40 pages. It might only take you about an hour to read. There's 3 links for you to click on inside my book. The very last link, go to all 3, but the third one on the last page, click on that link. It'll bring you to this private page of my website. And on this page, there's a 40-minute video of me describing my background as a physician, as well as my method. I give you some highlights into my method and the science I'm working with. So between reading my book and watching that video that's on the last page, it'll give you some great insight as to how I find what I find. And again, he has 100% relief, where CT scan, spinal tap, blood test, nerve conduction studies, they couldn't give an answer why. They told him he had neuropathy. He already knew he had neuropathy. He went in there because he had nerve pain. They couldn't tell him why. I also found with him that his lungs were infected. The lungs help bring oxygen to the brain. When there's not enough oxygen getting to the brain can feel stressed, the back can hurt, the chest can hurt, the brain can feel stressed and make your limb weak or make your limb hurt. So I found that he had the Zika virus in his lungs. He had the chikungunya virus in his lungs. He also had numbing chemicals from dental work in his stomach and in his lungs. He had MRSA bacteria in his blood, and he had activated mast cells affecting the cortex of the brain. The cortex of your brain has a map of the entire body. All the sensory for the body is really up here in the cortex of the brain. Doctors had taken off the skull cap, not in this patient, but they've done experiments where they take off the cap of the skull, expose the cortex, they put a needle in the cortex, and the person feels pain in the part of the body that part of the cortex represents. Understand? The hand is over here. They put a pin here. People didn't feel the pin go here, but they felt pain in their hand. So when an infection or activated mast cell or if something happens in this brain that's hurting the brain, a chemical that gets up in there, it can make you feel numb or pain in the hand. After his first protocol was completed, he came back to my clinic just a month later. The tingling in his body went down. The pins and needles feeling in his nerve pain, down 80%. The sensation he had in the top and the bottom of his hands, down 50 to 60%. The fatigue in the legs and arms and hands and forearms and thighs, and that was all the same. That didn't reduce in that first protocol. When he came back for his second exam, December of 2021, he was nearly 100% better. He still had some symptoms, throbbing in the bottom of his feet. His knees still felt fatigued. Now he's 100% better after the second protocol. And what I discovered with him in his second examination was he had a large amount of mold and mold toxins. He actually, in his home, many years ago, he was away on vacation, a pipe burst, and there was mold in the home when he came back that really smelled, and he got infected. But he didn't realize these nerve symptoms and weakness in the limbs until years later. It takes time for the mold to grow in the body. I found that arteries bringing blood to parts of his brain had mold and mold toxins. I found the frontal lobe of the brain had mold, multiple mold infections and mold toxins. His lymph system, his kidneys, a large amount of mold and mold toxins. I found that a part of the brain stem called the reticular formation, which helps to transmit sensory and motor to many parts of the body, the reticular formation was infected with the same molds and mold toxins. I found that he had Epstein-Barr virus affecting his spinal cord. I found mold in his liver, in his lungs, in the parietal lobe of his brain, which is where more sensations go down to the body from. He took these highly effective liquid energized drops that we designed for him from his second exam, and now he is, as he called it, 95% better. The only reason why he's got a little discomfort in his hand is because he was 100% better just about a couple of weeks ago. He took an antibiotic because he had a cold. He had a sinus thing. He took an antibiotic, and now the pain occurred in his hand. We're going to work with him on that symptom and have him come back in, and maybe we'll be able to get another report. But here it is, proof that this man with many, many, many weeks of feeling horrible nerve symptoms and weakness, and he couldn't even exercise. He couldn't do many things in his life because the pain was so bad. And now he's back to working out and working and enjoying his life again. And you can too. His puzzle is going to be different than yours. Maybe you will have 100% relief in one treatment with me. Maybe you'll have 100% relief in 3 treatments. I don't know. But what I do know is I've got a great method here that I've designed that can help me find where these different disease-causing infections and toxins are located in your brain and your body. And these highly energized drops, highly effective, safe liquid energized drops are going to help you rid these different infections from your tissues. There are frequencies that we can use, like we'll show you in this brief video I'm going to point out next to me. There are frequencies that we can use that can bombard the tissue with the infection that's in the tissue. The same frequency that's in the tissue, target the mold with the mold's energy, and you can get rid of that mold from that part of the body. And that's what we did for him. You too can get better, just like he's gotten better with my work. Again, go on my website, look around, read my free ebook, click on the links in my free ebook. You deserve to get better, and there's a lot of useful information, out of the box thinking that you can find on my website and in my book and in my videos. It's time for you to take action now and make your appointment with me and get better. Now, you can call my clinic at 954-370-3100. That's 954-370-3100. My lovely assistant will be very happy to help you make an appointment with me. You could also go on my website at drlonnieherman.com. There's a book appointment on every page of my website. You can just click this link that will take you to the book appointment page of my website, and you can even make your appointment right there on my website. Now, I'll tell you that insurance companies don't recognize my work. This will be an investment in yourself. You are number one in your life. You are number one in your family's life. You've got to get yourself better and get your life back. Your life, you've got to improve your function and live more quality in your years and quantity of your years. It's not just about the quantity, but you want quality in those years. So if you're the type of person who wants to get better, and you have gone through many different exams and many different treatments and none of it's worked, it's time for you to give this a try. And we're going to find the causes of your condition and help you get rid of those causes for you to get your life back. I appreciate the time we've been able to spend together today. Stay tuned for his complete testimonial at the end of this video. Take action now, get your life back. I look forward to helping you too. See you soon.
Hello, if you're somebody who's living with severe pain, tingling, burning, strange neuralgia or nerve symptoms, you deserve to listen to this video right now. I'm Dr. Lonnie Herman, and I'm with a great patient. This is Mr. Abundante, and he has come to my clinic here in South Florida for some really severe nerve symptoms from head to toe, and I'll let him share with you in just a moment. But these really severe nerve symptoms had gone on for many, many weeks, and somebody referred him here to my clinic, and now he's very happy to say that he has incredible relief from these symptoms with my work. Thank you for coming here and sharing this with everybody.
You're welcome, doctor.
Thank you. And if we can say you're at least 50 years old. Okay. And you live a pretty active life.
Correct.
In business and with exercise.
Yes.
And how many months ago, right now it's March 3rd of 2022, how many months ago did you notice that you started having these nerve symptoms?
The issues literally began the very early part of July. So I would say probably around July.
July of 21?
Yeah, July 21. So so we're going on now, what, a good 8, 9 months? 8 months.
Well, how long have you had, before we get into how bad the symptoms were, how long have you now been feeling the relief?
I started doing the protocols back in, I believe it was back in mid-September. I started, and gradually I noticed relief. To be honest with you, I was hoping the relief would come sooner, quicker, but obviously everything takes time. But I did notice that towards the end of December, I noticed a tremendous amount of relief of my of the ailments I was suffering. I was suffering nerve tingling from the top of my head to the bottom of my feet. My hands were tingling, my arms were tingling. The back of my neck and shoulders had a burning sensation. Also, muscle fatigue, especially in the leg area. So I went through a protocol regimen with Dr. Herman, and I saw a significant improvement towards the end of the first let's call it the first session protocol, which ended, I believe it was like literally around December 15th, approximately.
Right. So that was about a 2-month protocol.
Yeah, it was like I think it was like a 2.5 month protocol.
When you say significant relief, that was about how much, percentage-wise, if you could say, like a 50% reduction?
No, I would
20%,
say
80?
by December, I noticed probably like almost like say, for instance, like a 70%
70% reduction.
relief, exactly. And then we continued with the second protocol. Right now we're March 3rd. I'm approximately 2 weeks away from finishing the final protocol, and I would say I'm probably on 95%. Every so often I may have a little bit of tingling on my hands, but compared to what I was back in September, I would say it's night and day. Back in July, I didn't work out since mid-June, to be quite frank with you, and then I started working out now since the beginning or the middle part of January, where it's my own confidence level I was concerned to start, because I was afraid that some of the exercising would initiate some of the neuropathy feeling. So once I overcame that fear and started working out back in mid-January, I noticed that I had no ill effects, and I'm pretty much back to the way I was prior.
So when you would, before you met me in September, one of your symptoms was that you would feel the symptom that was always there in your body, it got a lot worse with the exercise.
Yeah,
right?
it was.
So that's why you had to take away exercise. You
Yes.
stopped completely.
Yes.
And even if you spent 2 weeks away from exercise or 3 weeks away or a month away, when you went back, because you couldn't live without exercise, because psychologically and
Exactly.
physically it was like almost torture for you to not exercise. I know the feeling. But you went back to exercise and it would flare you up again,
Exactly.
right? And that flare up would last how long after the exercise?
You know, it's really interesting because there was a period prior to seeing Dr. Herman, I worked out for a week. And then I noticed 2 days or 3 days after I worked out, all these symptoms and more came out. And it got progressively worse. So that's one of the reasons why I stopped working out, because I had this fear that working out would exacerbate my issues.
And now after your exercise, it's been many days of exercise.
Oh, I have no issues whatsoever.
No issues whatsoever.
Yeah, exactly.
When you first started feeling ill and you thought maybe you had that disease, and you went to a hospital here in South Florida,
Correct.
a pretty well-known hospital.
Yes. Yes.
And they checked you in, and they ran, what type of tests on you did they run?
They ran a significant amount of blood work. I mean, just not your typical blood work. It was pretty
In-depth, really intense,
Yes.
very a lot.
Yes.
They did a spinal tap,
Yes, which wasn't fun.
not fun, and they ran a nerve conduction test with you.
Correct.
When they got the results for the blood, did
All
they tell
negative.
You, all negative.
Yeah,
They
my
couldn't find
cholesterol.
anything.
Yeah, my cholesterol was high.
Because they were cholesterol high, which didn't cause your neuropathy.
No.
Didn't cause the burning neck
No.
and shoulders. Didn't
No.
cause the thigh weakness. Didn't cause your right arm to be weak.
No.
Didn't cause the tingling. Didn't cause any of that.
No.
They were looking for multiple sclerosis. They were looking for other kinds of nerve disorders. They could not find one finding. There was no virus, there was no fungus, there was no parasite. They couldn't find anything. They couldn't find any inflammatory markers in the spinal fluid. They couldn't find nothing. At the end of those 2 or 3 days in the hospital, and they didn't give you an answer, they just said, go home,
Correct.
basically,
Correct.
and live with it. And did you say, well, what do I do?
Well, they gave me some kind of pill.
But they gave you some kind of nerve pill.
Yeah, it was a nerve
let's
pill.
just say.
Exactly.
Did you decide to take it or not?
I take it sporadically. I'm not one.
Not one to be medicated.
Exactly.
But with that pill, did you notice any change in the symptom when you took it?
No, not really. No.
No change.
No.
There was no change with the medicine. There was no finding with the spinal tap, no finding with the blood, no finding with the nerve conduction. The only thing they could tell him was he had a neuropathy. Basically, they gave it a more fancy name, but neuropathy. He already knew he had a neuropathy, but that's what they told him leaving the hospital. I don't want to use the word for certain purposes of censorship here, but they did tell you when you first came into the hospital that you were positive for that pandemic
Yes.
created thing. But by the time that you left the hospital, they ran another nasal test and they told you were negative.
Correct.
Right. So,
Correct.
so if it was truly caused by that topic, they told him he was negative for it when he left the hospital. There was no treatment they gave you in the hospital either. It was all testing, and there was no
There was no
kind of magical medicine or
nothing.
or vaccine or anything.
Nothing.
Right.
I've always tried to keep an open mind. I mean, when I was going through my health issues, I tried pretty much anything and everything that I could try and see why I'm feeling the way I did. I also went to an acupuncturist and try and see if acupuncture. I was told that acupuncture sometimes can relieve some of the symptoms, and I had very little success with the acupuncture.
So your friend had referred you here, somebody who I know, who you know, and you gave this a shot. And right now, in the end, you're already referring a loved one here.
Oh, yeah.
Because you see a big difference in your body.
Absolutely.
And while I wanted it to be faster, just like you did, because the sooner you're better, the happier we're all going to be. And we can help other people like you who are watching this realize that you can overcome neuropathy and muscle fatigue when we do the right work. When he says he's 95%, there was recently you had to take a medication for something else, and maybe that's what caused a little tiny bit of the symptom in his hands.
Correct.
But if we get to work again and clear that medication that I think polluted the brain, we'll be able to get that out of the brain and have the hands return to normal. Something I found in your second exam that was a big part of why you were feeling this, even though it was years later from that one experience, there was mold that you had in the home all the years ago.
Yes.
And I found that in our second examination, and that's really was one of the big pivotal points, because you were probably I think you said close to 70% better
Correct.
after the first, but this is what really got rid of it. Getting the mold out of him is what really made the difference, more towards 100%. And he's not even done with the second protocol and feeling wonderful. And that protocol is very easy for you to follow.
Very easy.
Simple.
Yeah.
And you do it at home.
Just keep track of your
it,
days.
And pretty simple.
Yes.
So thank you for letting them know.
You're welcome.
I appreciate it. I appreciate that he's coming here to help you realize that you can to get out of some severe nerve pain, even when the medicines don't work, even when the testing that they performed on you have not been able to diagnose why you have your nerve disorder. We can help you get better, and you deserve to be well even when nothing else has worked. I am the physician who can help you get your life back, get your function back, and make you move on in life and enjoy yourself.
So when someone referred me to Dr. Lonnie Herman, to be quite frankly, I said, why not? I mean, I'm open-minded. I saw the videos. I did my own personal research, and none of the remedies are anything that's that could harm you. So I said, let's do this. I'm glad I took the leap of faith. Mm-hmm. And I'm grateful, and I certainly wouldn't be referring anyone if I truly wasn't grateful and a believer.